If you are age above 15, you by right should have your menses. Hi everyone, my name is Dr. Jerilee Azhari. I am a Paediatric Adolescent Gynaecology consultant in Pantai Hospital Kuala Lumpur, and I'm here to talk to you about teenagers' menstruation. Is it normal for my period to hurt? Well, to answer this question, there's actually two parts. It's either a yes, and it's either a no. It is absolutely normal for it to hurt a little bit, like a mild discomfort that doesn't affect your daily life activities. But if it does hurt so much that you cannot go to school, for example, you're not able to perform or do the things that you like and enjoy, then it is not normal. For example, some girls would actually use things like this, menstrual heat pack, put in their lower abdomen to see whether this heat produced can actually relieve pain. So much so to an extent, it causes skin blistering around that. In that case, it is absolutely not normal for you to hurt that much during your menses. Is it okay not to have my first period? Again, it is a yes and no answer. Yes if you're below 15 years old, and absolutely not normal if you're above 15 years old. If you are age above 15, you by right should have your menses, and if you do not, it is a very strong indication for you to seek advice from medical professionals. The term for a girl or a woman without menses is called amenorrhea. For example, a girl who do not have menses and never had menses, there's a whole list of things to consider, including abnormality of a formation of the uterus and the vagina. Of course, hormonal imbalance can also be one of the causes. Among older women, the causes can differ a lot from the younger ones. Is it fine for me to take hormonal pills? Yes and no. It is absolutely fine for a young girl to be consuming hormonal pills to, for example, regulate her cycles, reduce the flow of her cycles if it's too heavy, reduce pain during menses, and sometimes it can actually reduce formation of oil around the face and reduce acne. And it is absolutely not advisable for girls or women who have got a higher tendency for blood clottings in their system. When should I see my gynecologist? Some of the scenarios that a young girl could visit a Paediatric Adolescent Gynaecology would include not having a regular menses that could range more than 41 days, for example, or a heavier flow that affects your daily life activities, or the kind of pain that you have during your menses, that you couldn't go to school and do the sports that you like. Some girls even come to visit a Paediatric Adolescent Gynaecology when they found to have an ovarian cyst, for example, or they didn't have their menses due to some obstruction in the vagina. So there are a lot of indication for young girls to visit their PAG or Paediatric Adolescent Gynaecologist, and I'm just listing some of it. It is important for the Paediatric Adolescent Gynaecology to work together with you and your family to ensure that you have a good quality of life in school, in college, in university, and the betterment of your reproductive health in the future. For young girls out there, or mothers, or any adult woman who has got any burning question, feel free to drop your questions in the comment below.